Prescribing and renewing controlled substance medications for a patient are performed in a similar manner as prescribing and renewing non-controlled substances in previous versions of Clinical. However, there are some additional enhancements to the process, and of course, the additional two-factor security for sending a controlled substance electronically. In this section of the video, we will cover those additions and variations. Medications can be prescribed and renewed for a patient in a chart note or from the patient's face sheet. We'll begin the process of prescribing a medication, and when the Find Medication dialog appears, we'll search for Ativan, highlight it, and then click the Select button. In the Prescribe Medication dialog, the information for the medication will be populated. Controlled substance medications will show the particular schedule type in parentheses prior to the medication name. Generic drugs will appear with generic attached to the end of the drug name, while over-the-counter drugs will be appended with an OTC at the end of the drug name, and brand drug names will have the additional brand text attached. When prescribing and renewing medications, the overall process and functionality has not changed from previous versions. However, you will notice that below the started and ended date fields, an earliest fill date field has been added. The earliest fill date field allows you to configure the earliest fill date for Schedule II controlled substances. This field is required whenever you prescribe a Schedule II controlled substance. This field is also enabled when prescribing non-Schedule II medications, but is not required for those medications. Once all of the prescription information has been entered, it is recommended that you review the information in the SIG field for accuracy and to be sure there is no conflicting information. The SIG field contains the concise instructions for administering the drug to the patient as it was configured in the action, dose, dose units, frequency, and additional SIG fields above. This is the information that the pharmacy receives for filling the patient's prescription. After the SIG field is reviewed and is correct, click the Next button. If there are any applicable drug-to-drug, drug-to-allergy, or drug-to-disease interaction warnings, an Interaction Present dialog will appear outlining the warning. As before, you can enter or select a comment to override the warning, or click the Revise button to return to the Prescribe Medication dialog and change or cancel the prescribed drug. The Confirm Prescription dialog will display a summary of the prescription information, offering you the opportunity to review the information before you confirm the prescription. If you need to change any of the prescription information, click the Revise button. This will take you back to the Prescribe Medication dialog. When prescribing controlled substances, the location field will become active when there are multiple locations, allowing you to select the proper location and thereby the applicable DEA number when sending the e-prescription. When you are e-prescribing a controlled substance, you must complete the two-factor authentication protocol. To do this, check the Ready to Sign option, which will activate the Sign and Send button. You must now have your IdenTrust token plugged into your computer. Once the token is plugged in, click the Sign and Send button. The system will then validate the security certificate with the IdenTrust token inserted into the USB port of your computer. If the certificate and token match, you will be prompted to enter your token password. Once the password has been entered, click the OK button. The system will then send the e-prescription, append the note or generate a drug log, and then update the medication list in the patient's face sheet with the prescription information.